Hello everybody. Today I will talk about vomiting and upper gastrointestinal bleeding. Let's start talking about vomiting. First of all, what is vomiting? Vomiting is a reflex involving both autonomic and somatic neural pathways. Now let's try to understand how the process of vomiting occurs. It is a synchronous contraction of the diaphragm, the intercostal muscles, and the abdominal muscles, which raise the intra-abdominal pressure, combined with the relaxation of the lower esophageal sphincter. Both of these cause a forcible ejection of gastric contents. It is important to distinguish between vomiting from regurgitation and to distinguish between vomiting is acute or chronic, also called recurrent vomiting, as the underlying causes may differ. Now that we've learned the definition of vomiting and the process of vomiting, let's talk about the major causes of vomiting. 1. Alcoholism. 2. Drugs. There are a wide variety of drugs that may cause vomiting. These include non-steroidal anti-inflammatory drugs, digoxin, opiates, antibiotics, and cytotoxins. The third cause of vomiting are infections. Infections such as hepatitis, gastroenteritis, and urinary tract infections. The fourth cause of vomiting are metabolic causes. These metabolic causes include diabetic ketoacidosis, Addison's disease, and cyclic vomiting syndrome. As for the fifth cause of vomiting is psychogenic causes. The sixth cause of vomiting are CNS disorders. These CNS disorders include vestibular neuronitis, migraine, raised intracranial pressure, and meningitis. Furthermore, the seventh cause of vomiting are gastrointestinal causes, which include peptic ulcer disease, gastric cancer, and gastroparesis. As for the eighth cause of vomiting are uremia, and the ninth is appendicitis, 10th cholecystitis, 11th pancreatitis, and 12th intestinal obstruction. Our second topic today is acute upper gastrointestinal hemorrhage. Acute upper gastrointestinal hemorrhage is the most common gastrointestinal emergency. It accounts for 50 to 170 admissions to hospital per 100,000 of the population each year in the UK. The mortality of patients admitted to the hospital are about 10%. What are the common causes of gastrointestinal bleeding? How much each one of these accounts for GI bleeding? The first cause is esophagitis, which accounts for 10%, and usually it is with hiatus hernia. The second cause is peptic ulcer, and this peptic ulcer can be due to H. pylori or non-steroidal anti-inflammatory drugs, and it accounts for 35 to 50% of the GI bleeding causes. As for the third cause, which is vascular malformation, and it accounts for 5% of the GI bleeding. What is the fourth cause? And it is aortoduodenal fistula, which accounts for 0.2% of the GI bleeding. The fifth cause is varices. Varices, which accounts for 2 to 9% of the GI bleeding, and this varices can be due to liver disease or portal vein thrombosis. The fifth cause is Mallory West-Tier, which accounts for 5%. The sixth cause is cancer of stomach or esophagus, which accounts for 2%. And the seventh cause is gastric erosions, which accounts for 10 to 20%. Gastric erosions can be due to non-steroidal anti-inflammatory drugs or alcohol. Now let's talk about what is the difference between melena and hematemesis. Hematemesis, defined as vomiting blood. This blood can be red or black. Hematemesis is red with clots when bleeding. This is when bleeding is profuse. In comparison, when hematemesis is black, also called coffee grounded, when this hematemesis is less severe. Note that syncope may occur due to hypotension in the case of intravascular volume depletion. What symptom may give us a hint whether this bleeding is acute or chronic? The main hint which can help us identify or think acute or chronic is anemia. Anemia suggests that it is chronic bleeding. Now let's talk about what is melena. Melena is the passage of stool which is described as tarry, black, containing altered blood. Melena is usually caused by bleeding from the upper gastrointestinal tract. The characteristic color and smell are the result of the action of digestive enzymes and of bacteria upon hemoglobin. Severe acute upper gastrointestinal bleeding can sometimes cause bright red stool. Thank you for watching and looking forward to see you in the next video with a new topic.